So I think the idea about the speed at which these vaccines were produced and the risk of any safety issues, I think that has been, looked in a way that is perhaps it need to be improved. I think that the technology that we have now is such that we can make things happen that quickly. And furthermore, if we look at the science in general, the progress that we have had as a society really reflect that. I mean, I carry my phone, and my phone knows more about me than I know about myself. So, you know, to feel uncomfortable that these things are happening that quickly, I think that's the main issue that we need to address.
Will COVID-19 exist in societies around the world, or is there a possibility that we will be able to eradicate the virus as we know it?
Unfortunately, the answer is no. It's going to stay. I think that it's going to be part of the virology variety that we're going to have in the society, because there will always be a population that is susceptible. And those individuals are people who have never been exposed, and that will perpetuate. Now, the impact can be affected for the good or for the better with the vaccination. So I think that's the way it's going to be.
Bueno. And third question, if I have had COVID-19 and recovered, should I still get vaccinated?
So the answer to giving a booster vaccine if you have been vaccinated is actually that, yes, you should get vaccinated. And the thinking process behind it is that if you have already developed some degree of immunity, what the vaccine is going to do is a booster effect on the response. Now, we want to see those antibodies as high as possible, because there is a relationship between protection and the antibodies. So you have a high antibodies, your degree of protection is going to be greater than you have lower antibody levels.
What type of immunity is stronger, natural immunity or vaccine-induced?
I think that's an interesting question, because we know that the immunity that is protective, so I think that we need to narrow it to what is protective. The immunity that is protective against infection is the one that comes with the vaccine. So when you have the vaccine, you are getting that piece, the spike protein protection from the vaccine. So that we know that those antibodies are protecting us. The natural disease gives you a lot more antibodies, and it gives you a immune inflammation response that may not be necessarily protective. So in the context of all things taken into account, vaccine is always better because it only gives you the protection that you need.
The next question will be, are micronutrients effective at treating COVID-19 symptoms? So by micronutrients, we mean vitamins, minerals, supplements, things like that.
Okay, so this is one of those questions also that it's in the context. If you have a normal diet, and if you have no particular medical issues that you have to deal with, a regular diet should be enough for you to have the nutrients that you need. Now, that may not be the case with everyone. There will be people who may have some nutritional deficiencies. And remember, we talked about the zinc and all those things that we were using. And there may be people who actually have a deficiency in those minerals or those micronutrients that will benefit from that. But most people will not fall into that category.
Thank you very much, Dr. Meza. The next question will be, are there any medications besides vaccines that have shown to effectively treat COVID-19?
Yes, so the ones that I would say are number 2 in the list is the monoclonal antibodies. Monoclonal antibodies have been developed specifically to address the prevention of severe disease in those individuals who were not able to get the vaccine and don't have antibodies, or those who are exposure to high risk in high risk situations, and within a time frame, with a short time frame, can get the monoclonal antibodies. Those are useful and they prevent. They are not for everyone, so not every patient is going to, or individual is going to need them, but some of them will benefit. We know that the first medication, the remdesivir that came into the market, wasn't really as good as we expected, but it does have some benefit. We have steroids. We have several treatment options depending on what the stage of the infection is and how sick the patient is.
Our next question will be, do experts foresee any long-term side effects due to vaccination with RNA vaccines?
The short answer is there's always going to be side effects and potential toxicities. The data shows that most vaccinations are going to have a side effect profile within the first 2 months or so after you've been receiving the vaccine. So anything that is related to vaccine side effects or long effects are really going to be within that time frame. There's always been association between vaccines and other effects like Guillain-Barré and other type of things. And we know that when we put those things together, there's always going to be someone that has that relationship. We know that there's been some issues with the myopericarditis, inflammation of the the pericardium or the muscle, but those usually happen also within a very short time frame. So right now, the anticipation is that if anything is going to be happening with this vaccination, it's going to happen within a short time period more than the longer time period.
Wonderful. So the next question actually doesn't have to do with vaccinations, more with mask wearing. So does long-term mask wearing lead to CO2 intoxication, oxygen deficiencies, or any other health detriment?
So the answer is no, it doesn't. And I'm surprised because I have seen that in a lot of sports, actually, you are wearing a mask that restricts your oxygen supply. So people use it for the beneficial effects. Now, I know that this is not the purpose of wearing a mask, but my point is that the concern may be not necessarily that well-founded. The respiratory tract, our lungs, are perfectly capable to handling the oxygen and the CO2, the substances that we need to expel through our breathing. So I would not be concerned about it. It's not something that makes any particular effect, especially because we are not wearing a mask 24 hours. I mean, no one is wearing a mask 24 hours. And that would be the only time that I would be very concerned about that. And
talking about cloth masks, do they actually work to prevent infection or the spread of the virus?
So the answer is here. I mean, there is so much on the face mask that it's just incredible. I'm going to say this: wearing a mask is better than not wearing a mask in general, generally speaking. Second, the more filtering capacity the mask has, the better for the purpose. So if you are going to achieve any particular goal, such as protecting yourself, I can tell you the mask alone is not going to do it. It's not going to work. You can use a mask and you still get infected because a mask is not 100% protection, but nothing is 100%. So the combination of the things that you do is what really protects you from getting infected. So the mask is just one tool that you're using. Now, if you are in a hospital setting, when I go to the hospital, I don't wear this mask. I wear an N95. Why? Because the filtering capacity of the N95 is better than that. When I'm here or when I'm on the street, I use a different level. So wearing the mask that is not an N95, for example, is protecting you if I have COVID and I'm talking with you right now and my secretions, can potentially reach the respiratory tract. That's the benefit that you get by wearing a mask. Now, if you are infected and you are not wearing a mask and I'm inhaling then that's a level. So it's not to think about masks as the absolute yes or no, but more into what is it that you are, what level of a barrier you are achieving, and that's what you need to kind of think about that.
So speaking in general about all of this data about COVID-19, a lot of people have doubts about the science, the methodology, the data in general. So can we trust the quality of the COVID-19 data? Okay, so the gold standard, if you have want to have a study with the gold standard, you have to do a randomized, placebo-controlled, prospective trial, if that's what you want to do. Unfortunately, in infectious diseases, mainly, and what is really public health, that rarely is going to happen. You don't have the luxury to do a prospective, randomized, double placebo-controlled trial. That's not going to happen. So the data that you are obtaining always needs to be validated by the consistency of what you are finding in those reports. So, for example, just an example, ivermectin. I don't think there was an ivermectin question here, but I'll bring it up. Ivermectin is a favorite topic for that argument, right? Is the data good, the data bad? Well, there's only going to be one way to really do it right, which is good. I think that there is an NIH trial, like there was mentioned on the news, that there is that happening. And that's when you get the really quality data. So how do you trust the data? Well, you trust it based on what is most available for you in the science. I'll give you an example. When the data about the vaccine protection came about, you really don't have any way to tell at the hospital level, except by the numbers that you see every day of patients coming to the hospital. When the vaccine was available, the change in the number of patients hospitalized, it was incredibly
strong. You had patients from 250 patients that we had back in October, November, to right now we have 20 patients, 25 patients in the hospital. So when you see that, I mean, with all honesty, I don't need a controlled trial, which obviously.
So you're able to get the vaccine anytime after symptoms have resolved, but you should get it within the 3 months of being infected.
3 months, because that's when your immunity is going to start fading,
Thank you for that clarification. Another question is about allergies. So people might be worried about adverse effects to the vaccine. Can I be allergic to any of the ingredients present in the US approved COVID-19 vaccines?
The answer is yes, you can. There's been 3 or 4, I would say, there's been some substances within the vaccine that have been probably more attributed for reactions than others. There is one particular substance called polyethylene glycol, the PEG, and we use it actually a lot for laxative and for many other medical uses. And some patients may be allergic to that. The recommendation is obviously that if you had a reaction to the first vaccine, the first COVID dose vaccine, for the ones that are a 2-dose, you're not going to get the second one. But that's been very rare because the vaccine uses very little other ingredients. They use some lipids, and they use some mainly lipids actually, because it's a lipid-coated vaccine plus the PEG. So very little risk. But if you have any allergies to other vaccines, if you recall, there was always this precaution at the beginning when we were using these vaccines to maybe give them in the hospital or in a hospital facility because we were concerned about that. It's really very rare that we see that.
Thank you for clarifying that for us. The next one is a big question around school policy, and maybe this is a big myth that we can bust. What is the vaccine shedding, and can it be caused by any vaccines authorized for use in the United States?
Okay, the vaccines that we have currently available do not have an entire virus. They are pieces of the virus, or pieces of the genetic material, and they are not going to be able to replicate themselves. You have to have a full copy of virus to be able to replicate it into copies. That's the way it is. So you do not have that capacity in the vaccine. Now, there are vaccines that are live vaccine or live attenuated vaccines that potentially can do that. None of those vaccines are right now in the United States approved. And to my knowledge, there isn't really nothing yet that is widely available. So no risk for any shedding now. Can you still get infected with COVID even if you have the vaccine? The answer is yes, you can. We've seen that with Delta, right? Delta variant has made some people, and those individuals will have actually virus that is replicating, but not necessarily from the vaccination.
All right. So another question about the COVID-19 vaccines, maybe another myth we want to bust, is can any of the approved COVID-19 vaccines alter my DNA?
So, the short answer is no, they can't. And, there is and I know that it's difficult sometimes to understand it, but first of all, these vaccines are not going to be integrated into the DNA in any, if any, especially the RNA vaccines, they don't, in any meaningful way, meaning that they don't necessarily have any ability to change. And when the question is alter my DNA, I'm assuming that the implication is that they're going to alter in a way that I'm going to be someone different, or that I'm going to have some kind of a genetic mutation or something. Believe me, it is more complicated than that.
Perfect. Thank you so much. Another question is for people who are currently sick with COVID-19. Can I get vaccinated if I'm currently sick with COVID-19?
Okay, so if you have COVID, you are not going to get the vaccine when you're sick. You're going to have to wait until your symptoms are resolved, and you are assumed that once you are better, you have developed some immune response. You have developed some antibodies already. So what you are trying to do is give some window. You still need to get vaccinated, but you need to give some window for that immune system to recover from the infection. And also, you're going to have some degree of protection for the next 2 or 3 months. So you can wait up to 3 months, but not more than that, for getting your vaccine. You have to be already tested negative for the infection before you get your vaccination.
Okay, the next question is about kids. People are really concerned about whether or not they should vaccinate their kids. So, should my kids get vaccinated against COVID-19?
I'm almost afraid of answering that question because it's so controversial, right? So the argument is, so the short answer is, it depends, and that's not an answer, but the answer is this. if you are trying to minimize the impact of COVID in the society, the answer is yes, right? So you have to think about it in the, I think all humans have two modes, the selfish mode, the me mode, me, myself, and I, and then the community mode, right? The benefit for the greater good. So if your answer is me, myself, and I, then the vaccine is something that some people will be hesitant to let their children receive it. And I can understand that. But if the benefit of the intention of the vaccine is the community benefit, without any doubt, giving the vaccine is better than not giving the vaccine. Again, I know there is not a perfect answer, but that's the best I could come up because I know it's very controversial.
Okay, so kind of jumping back to the concern about fertility, if I'm pregnant or planning to be pregnant soon, can I still get vaccinated against COVID-19?
So the answer is yes, you should get the vaccine. There is two reasons for doing it. One of them, at least two reasons. One of them is you are protecting yourself against severe disease. We know that pregnant women, pregnant patients are more likely to have a high risk of severe disease, higher risk of severe disease than non-pregnant. And we know that if you have a child, and you breastfeed, the antibodies can be protective to that individual who's not going to be the baby, that newborn, that is not going to be able to receive the vaccine yet. So there is really no risk of doing that. The trials have been very well reported as being safe, so there shouldn't be a problem with vaccinating pregnant patients.
For people who are on WebEx, the question was, do you think we will be wearing masks for a long time?
I think so. I'm afraid so. And again, I got so used to wearing the mask now that is, to me, is not a really big, sacrifice, if you will. But I can understand again, what I have seen, and this is one of the major issues, is we are going to have like levels of intervention, right? So we're going to have things that we're going to do and not depending on the situation. And I think mask wearing is going to be one extra step in the process of having to contain if we ever get into another situation. I think this has been a good, if anything, a good training for all of us to learn how to wear the mask and understand and all that. I think it's been good. But I'm afraid that we probably will be using some of that, because first of all, this regularly used in the medical field every day. And I think this may definitely end up extending to the community.
Yeah, so he asked if the masks will help with the cold and flu season.
I think so. I think definitely, if the mechanism of transmission for these infections is the droplets, the mask does protect against it. Of course, there are recommendations on how to properly wear the mask. It has a good seal, that is the right size, that is a double layer, et cetera, et cetera. But that was actually the biggest thing that we actually, didn't mention yet, which is the benefit of the flu cases that went down after we started wearing and social distancing was significant. So I think that there is definitely a benefit with that.
So the question was, if a woman is pregnant, gets COVID, and gives birth, is it dangerous for her to breastfeed?
So we need to think about, again, if you have a patient who has had COVID before becoming pregnant, and then, correct me if I'm wrong with and then he becomes pregnant, okay? There is really, by that time, no particular risk of the infection being passed. And let me tell you why. The main mechanism they try to look into is respiratory tract. Most of the infection is going to happen in the respiratory tract. So meaning that the airways are going to be the ones who become infected. Once those antibodies, once the protection from the infection comes, those viruses will disappear. So you are basically, as a mom, as a pregnant person, will have only the antibodies, only the protection to give it to your baby. So there is really no risk. Now, we're assuming that the time between the infection, the time that this person got infected with COVID, the time that got pregnant, and the time that is breastfeeding has, it's been a couple of months. So the timing is very important. And I would not, in general, be concerned about that. So the answer is get the 2 shots at the same time. You get your booster, you get your flu shot on the same day. Now, let me clarify that, okay? The initial recommendation was to wait 2 weeks. And the reason behind it was not that the vaccines were not going to work. The concern was the side effects, right? Because people were complaining of side effects from the COVID vaccine, and then people, a lot of you already know that there is a lot of, I guess, common knowledge that the flu vaccine also can give you a side effect. Now that you know that you are having a side effect from one or the other because you already hopefully at some point got your two, I don't see any problem if you have not had any major side effects to get your two vaccines at the same time, because the benefit, your antibodies are going, your body's going to react the same way for the better. And the side effects now, if you want to wait, the only problem with waiting is people forget. We forget. We just don't do it, and that's what happens. It's not, there's nothing wrong with waiting. It's just that you will forget, and that's why.
So, can I mix and match my vaccine? So he's meaning, can I mix Johnson & Johnson with a Moderna booster, a Pfizer booster, etc.?
Okay, so the answer is now you can. I mean, you can. We've always done it, but we've done it without official, I guess, official blessing by FDA and by CDC. The news came just, I think today was the news release on that they are allowing the mixing and matching. If you think about it, the vaccines are so similar that the only concern that I would have about mixing and matching would be the side effects, really. Other than that, they are going to be effective, and they're going to give you the protection that you are, the purpose of the protection of the vaccine, regardless of whether you use one or the other. But generally speaking, you can, most people are getting the Pfizer right now, the booster Pfizer, even if they got Moderna, they got Johnson & Johnson. But there's no particular problem with that.
So the question is, how long should I wait after the second shot to get the booster?
Okay, so you have a window, 6 to 8 months. The time period between so you want to count the last dose that you received. So you got your second shot. Of course, you got the Johnson & Johnson is going to be the first. You wait 6 to 8 months. The data is really solid at 8 months, but generally speaking, the recommendation has been to do it at 6. So if you have already 6 months gone by and you have access to the vaccine, go and get your booster vaccine.
Okay, well, I think that is going to close us off. Thank you, everybody, for your questions. Thank you for coming, and especially big thank you to you, Dr. Meza, for your time and for your expertise. If you have any questions for EP Heat, feel free to reach out to us on any of our social media accounts. Yeah, thank you all for coming.